this video, I will share 8 tips for nurses wanting to work with moms and babies so that you can ace your interview and land your dream job working in obstetrics, labor and delivery, high-risk antepartum, or the NICU. I am often asked, how can nurses get jobs in demanding specialties within maternal newborn nursing? So today I will share personal insights on how I got my first job in OB, along with insights from working closely with nurse leaders and what worked from mentoring my students who started working with moms and babies right out of nursing school. Tip number 1, research the hospital. Do your homework. Research the hospital where you're interviewing. Learn about their maternity and their neonatal services, patient population, certifications, and any recent achievements or awards. For example, some hospitals offer in-house obstetricians, midwives, neonatologists, and pediatrician services 24 hours daily. Other hospitals might have a labor and delivery emergency room separate from the main emergency room just for pregnant moms, a dedicated high-risk antepartum unit with nurse navigator services, and a level 4 neonatal intensive care service for babies. Some larger level 1 trauma centers might deliver 5,000 births per year, while smaller hospitals might deliver under 1,000 births per year. Consider what level of care do you want to provide, and if the environment promotes your current and future career growth. Are you looking for a slower paced environment because you're planning to go back to school? Or are you wanting a fast-paced environment because you want to learn as much as you can at this point? Knowing about some of these services also shows your potential employer that you're genuinely interested in their facility and will also help you to decide whether the hospital is a good fit for you. You can also learn a little bit about the organization's culture, their values, by reviewing their website, social media activities, and patient reviews that you can read online. Find out how active they are within the local community. If possible, speak to current employees who work at the organization about their experiences. Tip 2, highlight your relevant clinical experience. Read the job posting and understand the role you're applying for. Obstetric nurses, known as OB nurses, also known as perinatal or OBGYN nurses, provide reproductive health care to women and their infants during, before, and after pregnancy and delivery. Ensure that your nursing experiences, your career goals, qualifications, and achievements match the job posting. Emphasize any previous nursing experience, certifications, or coursework that is directly related to your maternal or neonatal nursing. Do you have certifications in BLS, ACLS, NRP, or fetal monitoring? Having these certifications can make you stand out. Do you have medical surgical nursing experience? You do not need medical surgical nursing experience to work with moms and babies. However, depending on your interviewer, their views, and the pool of applicants you are against, it may or may not matter. Some leaders might value previous experience, while others might prefer to train a new nurse from scratch to meet the needs of the unit. If you are a new graduate, you can start in OB nursing right after nursing school. I became an OB nurse right after nursing school, and it was the best decision I ever made. If you're a new nurse, focus on your clinical rotations or volunteer services that you've completed in maternity units or any relevant coursework that you have completed to show your experience while you're in school. It also helps to make connections by attending nursing organization meetings within the specialty. For example, becoming a member of A1 and attending local chapter meetings in your area is a definite plus. I was an A1 leader for my local chapter for 5 years, and I enjoyed meeting nursing students and nurses. It was a great way to introduce them to various nurse leaders in the area. Tip 3, emphasize your compassion and empathy. Maternal neonatal nurses must be compassionate and understanding towards expectant mothers, partners, and their families. During the interview, share stories that showcase your ability to provide emotional support during pregnancy, childbirth, and postpartum. It is important to emphasize how you handled any challenging situations if you are experienced, or situation you might have witnessed as a student if you're a new nurse. Demonstrate effective communication skills by showing your ability to communicate complex medical information in a straightforward and understandable manner. This is important for the OB nurse because you will be communicating with practitioners at all hours of the day and night, and be expected to communicate effectively during emergency situations. Tip 4, dress and act professional. Regardless of if your interview is in person or whether you're interviewing virtually, dress professionally. Be aware of your body language and tone of your voice when you speak. Jeans, hoodies, and sleeveless clothing are not professional attire. Make sure that your clothing has a collar and a sleeve. preferably business attire with a jacket or a blazer. You can make professional wear look cute and trendy. For virtual interviews, make sure that you turn on your camera and that your background is free from distractions, pets, and other people. Make sure that your background is professional looking and not cluttered. And do not show your bed on camera. It is better to be against a blank wall or use a virtual background of neutral color. Turn off or silence your phone. Make sure your face is well lit or you're sitting in front of a window. Be on time. Plan to arrive at least 10 to 15 minutes before your interview to show that you're prompt and reliable. Tip 5. Prepare potential questions. Employers prefer candidates who are engaged in the conversation. Ask about the nurse-to-patient ratio, onboarding process, preceptorship experience, and the nurse residency and fellowship programs if they offer one. A nurse residency program is for new graduates or nurses within their first year after graduation, and a nurse fellowship program is typically for nurses with greater than 2 years experience or at least 2 years of experience who want to now transfer to a new specialty. Both programs have formal training to include classroom and clinical teaching to promote success. Find out if the hospital you're interviewing with has these programs. You might want to also learn more about the nurse retention on the unit and overall unit culture. Are there committees on the unit to improve processes and outcomes? Does the unit participate in quality improvement projects? Do nurses participate in huddles and rounding lactation services both on the day shift and night shift? What nursing certifications and trainings are encouraged on the unit? Do you help other nurses maintain clinical competencies? Some hospitals offer annual clinical competency classes for OB nurses to help you stay up to date. Remember that you're interviewing the panel just like they're interviewing you. Consider if the organization and the team is the right fit for you and for the long term of your nursing career. By the way, if you're finding this video helpful, please like this video and leave a comment below. It helps with the YouTube algorithm. Tip 6. Clean up your social media accounts. Check your online content and photos for unprofessional material. It is wise to make all accounts private except for your LinkedIn account, which should include a professional photo and current work information. This step is important because, yes, your future employers do look you up on social media. They want to learn more about your personality and to see if you're a good fit for their organization's culture. Tip 7. Follow up with an email. Send a brief follow-up email after the interview is completed, and this will help to set the stage to show your commitment in leaving a good first impression. If possible, address the letter directly to the leaders who interviewed you. Thank the team for their time and provide a summary on why you're the best candidate for the position. Tip 8. Be mindful on how you answer questions. Be prepared for behavioral questions that will ask you to provide specific examples of how you handled past experiences. These may include reflecting on your ability to prioritize patient care, ability to follow protocols, ability to delegate skills, and how you can be an effective team member. And very important, the interviewers want to know how you adapt to stressful situations. Emergency could occur at any time when working with moms and babies. How would you handle these situations? The interviewers want to know that you can perform effectively under stress, that you can ask for help when you need it, and most importantly, you know what to do in times of emergencies. Talk about knowing your resources, such as how to access the unit protocols, who is in charge for the shift, and very importantly, how to activate the in-house emergency protocols. Some hospitals might have an OB team activated for any OB-related emergencies within the hospital. There's always a NICU emergency team ready for any neonatal emergencies. Try to use true situations if you're experienced and hypothetical situations if you are a new graduate. Try your best to sound sincere and genuine with your responses. Be clear and concise with your response and remember to utilize the active listening skills. You can also use the STAR format when you're answering these questions, such as talk about the situation, the task, the action you took, and your result. Now let's go over some sample maternal neonatal nurse interview questions along with their answers. Question 1. Tell me why you want to work with pregnant women and newborns. A possible answer could be, before becoming an RN, I worked in labor and delivery as a nurse extern for for a year and I enjoyed the job. I learned a lot about pregnancy, labor, and delivery, which gave me a good understanding into what would be like to work on a labor and delivery unit as a nurse. I also volunteered in the newborn nursery for 2 years while in high school. I've always been passionate about working with moms and babies, so this would be my dream job. Another possible answer could be, before becoming a nurse, I experienced a pregnancy complication causing me to be hospitalized for 2 weeks. My baby was in the NICU for a month, and this experience opened my eyes to the love and care nurses provide to new parents and their newborns. I knew from the moment that my heart was to become a nurse and to work with moms and babies. It was my calling that I felt to give back so that I can become a nurse and help people. So that's more of a personal connection if you've had an experience like that. You can also say, if you're not a parent, you could share a situation where you observed during your OB clinical rotations that empowered you to become a nurse. You could also share any experiences that your close family and friends might have endured that provided you insight as to what maternal newborn nurses do. Question 2. Tell me about a time when you had to manage a high-stress situation while working with a mom or a baby. A possible answer could be, during my clinical rotation in the labor and delivery unit, I experienced a situation where a patient experienced a sudden complication during labor. The baby's heart rate dropped suddenly. I remained calm, called for assistance, and communicated effectively with the nurse and the medical team. We successfully stabilized the situation by putting oxygen on the mom, repositioned her, and the baby was born healthy. The experience taught me the importance of staying composed under pressure and the value of teamwork in labor and delivery to keep both mom and baby safe. Question 3. Describe a time when you had to advocate for a patient in a challenging situation. A possible answer could be, I once had a patient who wanted a natural childbirth but faced complications that required medical intervention. I advocated for her by ensuring that the medical team considered her preferences when making decisions. I used the BRAIN acronym by discussing the benefits, the risks, the alternatives, intuition, and the needing time. We found a compromise that allowed for the safest outcome while respecting mom's wishes. The mom was able to have a natural childbirth as she wanted, and this experience taught me the importance of patient-centered care and the nurse's ability to be your patient's advocate. Question 4. Tell me how you stay up to date with the latest trends in obstetrics nursing practices. A possible answer could be, I'm a member of A1 and regularly attend the local chapter meetings. I also attend OB conferences and online webinars on topics that I want to learn more about. I read articles published in OB nursing journals. Also, I'm interested in opportunities for advanced certifications, and I'm looking forward to become NCC board certified in OB nursing. If you're a NICU nurse, you can share similar response, including the NAN, which is the Organization for Neonatal Nurses, and a potential training could be earning the CCRN certification that's specific to neonatal nurses. If you enjoyed this video, subscribe to this channel for more content. Together, we can mentor, educate, and inspire. See you in the next video.